are they safe for people like me? So both vaccines were considered equally safe and worked equally well across different groups, like genders, different races, different age groups. And here's a couple of breakdowns. So you can see that at least 100 or even thousands of people from each type of ethnic group were tested. Like just to give an example, around 10% of the individuals, which equals about 3,000 or 4,000 people, were African American. Although the vast majority is white, there were significant representation from people of color. Also, it was tested equally in both women and men, about half or of the participants were each gender. There were a number of people who were 65 and older for both, like around 21 to 25%. And people with underlying health conditions who are at risk of severe COVID. So think of like asthma or obesity or diabetes, conditions like that. So they were well represented also with both in both trials, vaccine trials. Are there other vaccines? Yes, other vaccines are being tested, a lot of them. So this is just an example from the New York Times. And here are some leading vaccine candidates that you probably heard of. To give a note, phase 3 vaccines is phase 3 clinical trials. This is like the big tens of thousands of people trials. And so there's 20 of them in that process. So if they manage to clear that and get good results, we might be seeing vaccines from this group in particular kind of get approved. Are they effective against variants? You must have heard about the more contagious variants that originated in the UK and another one that originated in South Africa. I'll mention that the CDC just days ago described the UK variant as being widespread in the US at this point. They unfortunately believe that by March, it could be the dominant strain in the US if we don't take actions now. So, and this variants, they're not more lethal, but they are more contagious. So if you're in a room with someone with this variant, chances are you'll catch it a little bit easier than if you were with someone who had the original COVID version. Now, in terms of vaccines, most people in the scientific community think it's unlikely that these mutations will change how effective the vaccine is. There's more research that needs to confirm this, but it's looking pretty good that these new versions of this bad virus won't, the vaccine will still work against these new versions. In terms of payment for the vaccine, no, you don't have to pay for the vaccine. The government is providing it at no cost, but just flag that there may be administrative fees associated with it, which should be covered by your insurance. And if you're uninsured, we're providing a government relief fund that can be used to cover your costs. When will it be available for the general public? Right now it's limited, but it should increase over time. So especially later in 2021 for adults, but it may not be available, especially for young children, until a little bit more research has been done. And so in terms of prioritization, healthcare workers, nursing home and staff and residents, frontline and essential workers, and people over 75 are some of the people who are prioritized to get the vaccine, sooner rather than later. I'll let Casey now describe the Ohio website.
Yeah, so a lot of these decisions are being made on the local level. So we just wanted to give you an idea of where you can find information specific to Ohio. So the Ohio Department of Health has a page specifically for coronavirus, and they have a tab about the coronavirus vaccine. If you could advance the slides.
Sorry.
And if you follow that link, it will bring you to a new page. And it looks like this. And here you can find resources about the different phases of the vaccine and who is included in each of those phases specific to Ohio. And they also have this information in a variety of different languages, as well as in formats that are easy to share on Facebook or Twitter, if that's something that you would find useful.
All right, so who's making the decision of who's going to get the vaccine first? So there is a group of health advisors advising the CDC. They're trying to incorporate different aspects of science, ethics, and just the basic implementation that needs to be considered. But it's ultimately state and local leaders that will decide the prioritization. Where will you need to go? The places you might expect, like doctors' offices and pharmacies and hospitals. But you should check your local website, local government website for more information. Are there risks associated with getting the vaccine? Like mentioned, it's similar to what you might get from a flu vaccine. I usually think of it as like a punch in the arm. I sometimes feel when after I get a flu vaccine. It just means, kind of minor things that'll disappear in a few hours or a few days. And it's a signal actually that the vaccine is working, your body's immune system is working against the virus. What's the risk associated with not getting the vaccine? I mean, unfortunately, you probably already know this, but this disease can sometimes be fatal and sometimes cause long-term symptoms and sometimes just cause a lot of devastation otherwise. So you and your loved ones may contract it. You may not be able to, you may get the more severe versions of it. And here's a list of types of symptoms which, inability to work, hospitalization, and death are included on this list. For more trusted resources, so the ones we mentioned earlier, we'll just also flag that Ohio Department of Health is another example for trusted resources. If to get vaccinated, even if I don't have symptoms, risk symptoms, I'm sorry, this is a slide for Casey. So Casey, if you can.
Yeah, no worries. So based on how kind of the spread of the virus works, the more people who have immunity to COVID vaccine, the better. And this immunity can come from either having contracted COVID-19 and building up defenses that way, or having been vaccinated. But the truth is that basically by getting vaccinated, it's the safest way to develop that immunity. And by getting vaccinated, you're not only protecting you, but also those around you who may be vulnerable. And so we created a little graphic to give you an idea of how getting more people vaccinated helps stop the spread of the virus. So imagine that this is a community with absolutely no immunity. The virus is able to spread without anything getting in its way. Now, if you have a community with about 45–50% immunity, the gray dots represent those who have either received the vaccine or have developed immunity from having COVID-19. And you can see that the pink dots don't spread quite as far. And then in a community with about 90% immunity, the virus isn't able to spread far at all. It perhaps is limited to just one family because it starts to come into contact with people who are vaccinated. And that's kind of like, it can be seen as almost like a brick wall for the virus. It can't really go much farther.
And how many people need to get vaccinated to prevent the spread? So we estimate that about the top health experts estimate that about 70 to 90% of the population will need to be immune. So this will include people that are both vaccinated and people who've already come down with COVID and have some immunity. So it indicates that probably a large majority of the population will need to be vaccinated. Do I need a social distance? Yes, after you get a vaccine, you still need to social distance. It's a little bit uncertain right now. If a vaccinated person can spread the virus to others, the vaccine's main job is to stop you from having symptoms, but there is evidence showing that it probably can work to stop the spread, but it's a little bit preliminary and still more research needs to be done here. And if you've already had COVID, you are eligible to get the vaccine, but just, and it's very, very safe for this group, but just FYI, it's a little bit less certain how the vaccine can work on preventing future infections. But if you are currently actively symptomatic, don't get the vaccine. Just wait till you recover, okay? And obviously talk to your doctor about whether you should get the vaccine. This is another type of thing. So a couple of ideas on what things you should think about when making this decision. Are you at risk of these severe symptoms? Who are you in contact with? Can you work from home? Spreading the disease, would you be able to spread it to your loved one? Can you spread it to essential workers? That kind of thing. And in terms of safety and availability, as you mentioned, it is considered safe and effective. There are very few side effects. It has been tested in people like yourselves, and it should be available to you without charge. And unfortunately, to end the pandemic, we do need a number of people to get vaccinated. So thank you, and that's the presentation.